shoulder pop during certain movements. Should I be concerned?
So that really depends on if there's pain associated with the movements or not. So if there's no pain, it's most likely just related to gas bubbles being released in the joint from a change in pressure. If it is directly associated with pain, then it might be something worth looking more into.
How is tightness in the pec muscles related to shoulder pain?
So tightness in the pec muscles can affect the shoulder in a couple different ways. So first you have the pec major, which attaches to the humerus, and that can pull the head of the humerus, essentially pull the ball of the shoulder joint forward in the socket, which can change mechanics in a way that can create pain. Or you can have the pec minor, which attaches to the scapula, to the shoulder blade, which can cause the whole shoulder to be rounded forward, also changing mechanics and contributing to pain.
What is the rotator cuff?
So the rotator cuff is a group of 4 muscles in the shoulder. So you have the supraspinatus, infraspinatus, the subscapularis, and teres minor. The main role of the rotator cuff is really to help hold the head of the humerus, or the ball of the shoulder, in the socket during movement.
What is the shoulder labrum?
So the labrum is a fibrocartilaginous ring around the socket of the shoulder that creates a suction effect on the ball of the joint to help hold it in place during movement. So essentially it functions to help with shoulder stability.
How can an injury to my neck cause my shoulder pain?
So a neck injury can contribute to shoulder pain in a couple different ways. So first, there are a number of muscles in the neck that also attach down into the shoulder region. So if you have an injury to the neck affecting those muscles, then those muscles can either create pain directly themselves, which can refer to the shoulder region, or they can change the mechanics of the shoulder in a way that can create a separate but related pain in the shoulder itself. Additionally, you could also have injury to some of the nerves that exit the neck, passing through the shoulder region. They innervate all the muscles and nerves in the shoulder, but also all the way down into the arm and the hand. So if you have an injury to any of those muscles at the neck level, it can cause pain in any of those areas.
Why does my shoulder hurt when I do a shoulder press in the gym?
Yeah, so that one's a little bit tough to answer just because there can be a number of things involved, but the easy answer really is that you're probably lacking mobility or strength in any one or a few key areas in the shoulder that basically make it so that you can't perform that movement correctly, or that the shoulder ends up tracking in a way that's not, that's not correct and can create pain in the shoulder.
What is an AC joint separation?
So AC separation is just a sprain of the ligaments that support the AC joint. The AC joint is just the articulation between the collarbone, clavicle, and the acromion of the scapula, so right on top of the shoulder. Higher grades of that injury, you can actually have like a separation of those two joint surfaces, and you'll see like basically the collarbone poking out at the top of the shoulder. So that would be AC joint separation.
How do I fix my rounded shoulder posture?
So rounded shoulder posture usually is related to just spending too much time in one position. So getting up and moving is a big help, but it can also be related to tightness in the pec muscles, as well as weakness or like lack of tension or tone in the muscles of the upper back. So really building up mobility through the chest, and then building up strength in the upper back, as well as just trying to get more movement throughout your day.
Why do I always feel so tight on the tops of my shoulders?
Yeah, so a lot of people tend to carry stress or tension in the upper trap and through the top of the shoulder. Usually this is related to, again, not getting enough movement throughout your day, spending too much time sitting in front of a computer or maybe on your phone. So really the biggest thing is just trying to get up and move more throughout your day, do more things that get you out of that constant like forward position, and again building up strength in the muscles of your upper back, and then building up mobility through the chest can be helpful as well.